My name is Christina Wallace. I'm going to be performing a finger check, and I'm also going to be mixing and administering insulin. The first thing I'm going to do is verify my order. I'm going to walk into the patient room. I'm going to say my name. I'm going to ask them their name, verify their wristband. I'm going to clean my hands, perform hand hygiene, and put on gloves. I'm going to explain the procedure to them, let them know I'm about to be checking their sugar. I usually ask the patient which finger do they prefer. I'm going to make sure that I have all my equipment as well before I go in the room. My machine, my lancet, my alcohol pad, my gauze, and my strips. Usually I would already take the strip, insert it into the machine. Also make sure that the controls are done on the machine as well to give you an accurate reading. I'm gonna apply the strip in the machine, close the lenses back. I usually go in the room, make sure that the patient's hands are clean. I usually ask them which finger do they prefer. I would take the alcohol pad, open it up, get whatever finger they prefer, wipe it with alcohol, let it dry completely. And then what I would do is I would take the lancet. I could stick the outer side of the finger. I will wipe the first drop of blood off. I can kind of squeeze the finger, milk the finger if the blood is not coming. And then take my machine, hold it to the finger, get the blood, put the machine down, and let the reading come. Depending on what the reading is, that's how I know how many units of insulin that I will have to give. I will also take this and hold it to their finger to stop them from bleeding. I would take off my gloves, perform hand hygiene again, and then also I will get the insulin. So we can say that they just ate lunch and they were 240. So I have my insulin. I usually go from clear to cloudy. This is my cloudy, this is my clear. I would make sure that I kind of rotate the vials in between to make sure that the insulin is mixed well. Like I said again, I will verify the mark to make sure I know how many units of insulin that I'm giving them before I give them. I will pop the tops off of both of the insulins. Pop the tops off. I will open my syringe, and what I would do is if I'm giving 5 units of the cloudy insulin, I would pull back to the 5 and then make sure that I'm not touching the solution. I would inject the needle in and then inject the air in. I will pull it out, then I will pull back. I'm giving 5 of regular as well. So I will pull back. I would inject that amount into the clear, and I won't take it out this time, and I will pull back the units of insulin that I need for that one. Make sure I don't have any bubbles. Then I would go to the cloudy, pull back, and get the units that I need. Okay. If I'm doing this outside of the room, I would just be careful and recap. I would have another nurse verify this and look at it with me. Then I would go into the patient's room with the insulin. I would ask them which site do they prefer. Some prefer the arm, some prefer the abdomen. Let's say she prefers the abdomen. I'm going to go in the room. I'm going to take an alcohol pad, clean the site in a circular motion. And then I'm going to pitch up 1 to 2 inches depending on how big the person is. I pinch the area. And then I insert the insulin, inject it slowly, and then I pull back, put my safety guard on, and then I can take a gauze of alcohol pad and hold it so they won't bleed out. And then I will go document all this in the system. And I will clean up my area, take off my gloves, and perform hand hygiene again.